So I shadowed at the SMART Clinic, which stands for Supportive Medication Assisted Recovery. So this clinic uses the drug Suboxone to help with the drug addiction cravings. So I shadowed pretty much 3 doctors throughout my time there. The way the therapy is set up, only shadowing one would not be beneficial because the therapy that these individuals go through is broken up into 3 sections. So this clinic offers group therapy and individual therapy as well. I didn't get to see any individual sessions, but the group session was super interesting. It really broke through the stereotype I made up in my head of what an addict looks like. All the patients were in such different stages of recovery as well. Some of the patients had been clean for years, while the man next to him could have gotten high the day before and come to the clinic. I felt like this was super beneficial for both sides to see, so you can kind of see where you were and where you could be. So therapy was broken up into 3 sections, like I said earlier. The first part was kind of like a catch-up with one of the physicians. The patients just talked about how their week went and how the recovery was going for them. The second session had another doctor. He talked about the medications, the Suboxone therapy. The last session was educational, so each week they pick a topic in recovery and go over it with relevant videos. So like they'll use clips of Forrest Gump to show recovery and all that. So for my shadowing week, it was all about addiction and how it affects the brain. I also learned a little bit about how the therapy is set up in general. So it starts out as a weekly situation, and over a given amount of time, it turns into less frequent visits. But if the patient were to slip up or lie about a drug test, they'd be brought back to once a week therapy. There are regular and random drug tests, and there's also random pill counts. So if you mess up on those, you might be brought back to once a week too. Something really cool is that they actually are funding to use Ubers to bring patients to the clinic if they can't get there themselves. They really don't have an excuse to not come to therapy. I did not observe any nurses there. There was not much interprofessional collaboration either. They just had a clinical licensed social worker working there. The team did a conference meeting before therapy to go over each patient that day, and they're both doctors and then the clinical licensed social worker in attendance. The social worker briefly went over the patients with the doctors and told them important information that they might have needed. So this was such a rewarding experience, and I'm so thankful that I got to see it and really grateful for this program and forcing us to go out and see how other healthcare fields work together. It was such a cool experience. Thank you.